Thank you, Hindi team. Now it is a time for the English session. We are moving to today's session. Today is our 1367th day of continuous webinar. Before beginning the session, we will have a silent prayer. Thank you and welcome once again. Thank you all the participants for joining with us. And thank you all the faculties. You are sharing your knowledge here. That's a great, that is the purpose of our IFPH, to share and get know each other. So we are traveling on the way of fulfilling our dream. Thank you so much. Today's our guest is JUMANA HASEEN. She is from Basel Homeopathic, and she's all of you know that Basel Homeopathic is a group of doctors. They are giving awareness about homeopathy and awareness about many subjects. Very informative. They have, I think, 25,000 subscribers. They have daily. They are giving knowledge to the world about homeopathy, and they are taking a good role for promoting homeopathy. Like IFPH, they are a group of young and powerful doctors. They are trying to spread the knowledge of homeopathy. Welcome. And she has 7 years of experience as a consultant in Basel Homeopathy. And Dr. JUMANA, you are welcome to IFPH. Thank you. You can start now. And you are the co-host now. You can share. I have to share, right? So I forgot. Wait. And the Zoom there.
Yeah, am I audible, Dr. Ajni?
Yes, you are audible, but can you? I cannot. I cannot see the Zoom link. You can see me, right? I don't know what happened.
Yes, she's there in the top. We can see it. She's also co-host, so you can go ahead with the session.
Okay, doctor, please start. I don't know what is happening. Okay, I came back. I will share it.
You may begin, Doctor.
Okay, you can start now, doctor, please.
Yeah, hope I'm audible. Yeah, thank you, Dr. Ajni, for the brief introduction. A very warm good evening to all. So it was my immense pleasure to be a part of IFPH webinar session, today's webinar session. So today's topic is regarding the panic attack anxiety and the modern.
Doctor, is it audible, Dr. Danesh?
Am I audible now?
Now
Yes,
it's
yes.
audible.
Now it's audible.
Yeah, now it's audible.
Yeah, okay. I think some network issue is that's why it's suddenly it's going off. Yeah, that's okay. Let's start the session today with a grateful thanks to IFPH team and Dr. Basil Yusuf, Basil Homeo Hospital. So today's topic is regarding the impact of modern lifestyle on the prevalence of panic attack and anxiety disorders. Today, our mental health is more affected due to the various lifestyle changes which we have adopted. Am I audible now?
Yes, doctor.
Yep. Okay, right. Okay, thank you. In clinic also, a lot of patients are coming regarding this anxiety disorders and panic attacks. So that's why I chose this topic to be today. And what is the panic attack actually? Panic attack, it seems to be like anxiety only, like your heartbeat rises and everything, like we are going to an examination, or if you're going to like examination funk, they'll get these symptoms as if they are going to die. They're like the same symptoms, the patient will be mostly representing that. Their heartbeat will be rising, and they'll be feeling like as if they are collapsing, and they are sweating like anything. These are the major symptoms of panic attack. And this anxiety disorders, it is a minor form actually. It will be like only like few seconds will be there, this anxiety disorders. You can change the slide now. Yeah. The panic attack is a sudden episode of intense fear. That's like if at all we are going outside, when we suddenly face animal or a dog is coming in front of us, we'll have this noradrenaline and adrenaline, this flight and flight mode, like fight and flight mode of hormones will be released. Like these type of hormones will be released to these patients without any particular cause. Like there might not be any particular concerns, or there might not be particular reasons. They'll be surrounded by people only, but sometimes all on a sudden they feel like they are alone, and they could not breathe properly. They are literally going to die. They are something in danger. That is how they feel these panic attacks. And again, this is more prevalent today. Like the major causes are like the lifestyle disorders, like the more we depend upon the screen times, and our sleep schedule has been greatly reduced due to this more involvement of screen time and all. And of course, this sleep and this panic attack also related, as our melatonin, that is that hormone which secretes during the night time, that might get disrupted due to the more night watching, and the IT professionals and all, they are opting like more night duties and night shifts. So this may imbalance the biological rhythm and biological clock of the humans, their body, and it will very worstly affects the hormone serotonin, which is a happy hormone. So melatonin and serotonin, it is very linked to that. So that is why these lifestyle disorders, mainly this lifestyle disorders has been associated with the panic attack. And another thing is that the anxiety disorder and panic attack, whether it is similar? There is a most of the time the people will ask. Anxiety is quite like it more severe form of panic attack is more severe form of anxiety. That is, anxiety will be like a mild symptoms only will be there. They'll be feeling some irritations in the mind. And of course, the increased heartbeat, it is both common for this. But these people, for panic attack people, they'll just feel like alone, detached from their life. They're not at all in the present situation. That's what they'll feel. And the chest pain will be immersed. That increase. That is most of the time what the patient feels like, it is like a heart attack. So they'll suddenly go and go to the hospital and do all the tests, whatever way possible. They'll do all the tests, and it comes like nothing major reasons has been diagnosed in that. And the prevalence rate, how it affects the major persons. That is, in the 12-month prevalence, the adults, which has got a 22.7%. Among that, the severe cases are like 44.8%. So depression also related with this panic attack and anxiety disorders. That is high as 50 to 60% has been involved in the. And what is the these people, what they'll do, like they'll actually depart from the society. They'll unable to attend any social functions or social circumstances. They'll avoid these situations because the things they experience, the people might not understood. That is the first thing. These people usually in the initial stages and they won't share with any person. Even they are afraid to face or to consult a doctor itself. What if they got any severe or any deadly disorder? So that's what the major concerns will be. And what they'll do is mostly they'll search on like Google search. They'll use the technology for this. They'll go search all the symptoms, and at last they find it somewhat. If it is associated with stomach symptoms and all, they'll come to find it as a cancer. They themselves diagnosed. That's what happened, and that makes these symptoms more and more worse. A previous slide, please, doctor. Yeah. These symptoms may they'll begin their symptoms in the beginning, like whenever any past traumatic disorder is there, or there might not be any particular reason. If they are going for a driving, suddenly they'll feel like this, and after these symptoms has raised, they'll afraid to continue the same thing. Like if they're going alone driving, they'll feel very discomfort. They avoid driving alone, and even they are afraid to meet new people and friend circles. Everything seems to be like somewhat associated to phobia, but this is like in an extreme version. Their symptoms are more worse. Next slide, please. Yeah, the modern life factors which has been associated with this panic attack and anxiety. The more and more like stress and pressure we are giving in our work, both in our work and family life, we are stressing like anything. This may increase the cortisol hormone, and this also imbalance the biological rhythm, and it will affect the mind like anything. Also, the sedentary lifestyle. The most of the time, what happens is that the physical activities, like what we were now, most of the people, we are not into physical activity much. Actually, this physical activity will release more and more endorphins, and which will be more helpful to reduce the stress level in our body and cortisol in our body, and that will more increase the happy hormones too. So due to this lack of physical activity only, more and more persons are going to this like panic attack and anxiety. Most of the time there is a sedentary lifestyle will be there, and they won't be involved in any physical activities, screen time much, and more online processes and online works are there, and always like sitting. That is what the modern lifestyle. And also due to poor sleep habit, like sleep hygiene, like 70 or 80% of people are not maintaining the sleep hygiene. Like sleep hygiene, it is 7 to 8 hours of sleep is very mandatory for an adult. Most of the time, due to work pressure or due to the stress we are getting into life, like anxiety, and by thinking of the future things and all, our sleep schedule is like distracted like anything. This may definitely affect our health, that all we know. But what these people happens is that due to the sleep deprivation, their panic attack and their symptoms get more worsen like anything. That they may even not cannot control their symptoms by themselves. That much worsen it happens due to the poor sleep habits they are maintaining. So usually for getting a good sleep, what we'll suggest is that to have the dinner before 6 to 7, that is before 2 to 3 hours before the sleep schedule, have to finish this dinner, so that while our mind is sleeping, our stomach also lets sleep. That's what the usual telling. So these sleep habits should be maintained. And another thing which causes is that unhealthy diet, that mostly the caffeine content, caffeine intake, that reduce the sleep schedule, and that will reduce the sleep timings very worsely. Mainly for if the person is having a habit of taking tea or coffee in a regular basis, mostly what we will tell is that to avoid those caffeine intake in the evenings, so that mind won't be alert like anything. And unhealthy diets also, like fatty foods, and which we were more interested, like junk food. These may disrupt the gastroenterological functions, and these also may may feel as a triggering factor for the anxiety and the panic disorders. As the studies today, they are telling like that, like stomach also has that associated with happy hormone, has been associated with stomach symptoms, it seems. So most of these lifestyle disorders, IBS, and these panic attack and anxiety suffering patients, they might have, like mostly they'll suffer with this IBS symptoms too, irritable bowel syndrome, like alternate constipation and diarrhea also. And excessive use of technology and social media, that's already I told you, like too much of screen time, like this melatonin hormone, to secrete it, it needs a night mode for function it properly. But what happens, even if we go to sleep in night, often we scroll Instagram and all the social medias, we scroll like that. And what happens due to this light radiations and all, it will interrupt our melatonin secretion in the body. And often what we lead to is that we'll go for a stage of insomnia. And the night sleep is very much important. That is for the secretion of melatonin and this happy hormone serotonin. So even if you slept 8 to 9 hours in the morning, that won't be much helpful to balance your physical and mental health. And how chronic stress and pressure and relationships and other sources which can trigger your anxiety and panic attacks. So most of the time what happens is that due to any acute things also, these symptoms may arise. Like if any relationship breakup or a divorce or any disconnection with someone happens, like if we are connected to some people, some type of happy hormones and some type of good things, good feelings will rise in our body. So sudden abruption from it may lower our body's hormone level, and it may imbalance the biological rhythm too. And this may trigger the anxiety, like they feel alone, and this may worsen the panic disorder if they have not considered in the beginning itself. Definitely, it may lead to panic attacks, severe panic attack symptoms. And next thing, what we have to consider is that how this stress response. We are telling like stress will be affected, how it will be affecting. Like it is like too much exposure to cortisol. That's what I have already told. So this may put your body in high risk of many problems that we all know that this cortisol hormone is the main stress hormone, which is mainly released due to this so much of stress. So whatever be the stress in the society or in our lifestyle, we ourselves have to balance, to giving our health, physical health and mental health, an equal priority. Only our mental health is good, then only our physical fitness will also improve. So for that, we have to reduce the work stress level to like 24 into like 7 hours. We are working like anything to earn money. And after all, after buying all the diseases then we are spending it to hospitals. That's what the scenario now it is happening. We were running behind those earning money, and we're forgetting our health. That is the thing, prime importance. Even we doctors also sometimes not giving me time. So that may definitely affect the mental health like anything. Because we often prefer the patients as our first priority. But our health is more important, because only if we are good, only we'll treat more and more patients, and we'll be giving a goodness to others. We can spread goodness to others. So our health is very, very mandatory. So we have to look after that. I think first, before telling to the patients, so we doctors and medical professionals, we ourselves have to follow these instructions. Most of the time we give to patients, but we forget ourselves, like having a healthy diet or taking food at the proper time. That most of the medical professionals also, we skip that. Like taking food in the proper time, we skip that. And also this night sleep, proper hours of 6 to 7 hours of night sleep also, we want to give much importance to that. We have to consider that. And whatever problems is arising in our life, definitely it will affect. We want to overcome from that stress. For that only, we have to involve in more and more like innovative things, like learning new things, and like physical activities. Physical activity, definitely it will increase the endorphins, and it will reduce the stress level like anything. So jogging or walking, physical activity is very much important for that. And again, to coming, yeah, that's what I have told her, to reduce the stress. Yeah, vitamin D, this is more getting related today, because today, whatever be the symptoms coming, most of the time, vitamin D, if we have checked, it comes under the normal value. So what usually, this panic attack and vitamin D has got more relation. I have to tell a case regarding that. One of my relative only, they approached me like that. They haven't checked vitamin D at all. They approached me they are getting the same symptoms of panic attack, severe, but they're not telling, they are not knowing that it is a panic attack. They're telling like, I'm like anxious more, heartbeat is increasing, night I'm unable to sleep, and even I feel like I'm not worth to live. That much depression she has been suffering like anything. And what they have done, they have consulted a neurophysician, they have consulted a cardiology, because heartbeat are rising. So they themselves diagnosing it somewhat, and they are going to the doctors. They're consulting mainly so many doctors, and even they are taking much and more medicines to reduce the heartbeat pulse rate. They are taking some medicine, and to reduce the to increase the sleep, they are taking some other medicines, and to increase appetite. She's not getting enough appetite also. She's feeling so lethargic, so energyless. So for that also some medicine, like a 10 to 15 set of medicines she's having daily like anything. And she haven't had this vitamin D level checked at any cost. So what? So just she came to me, and I told her that just check this vitamin D level. No, I'm having this all symptoms. Let it be. Just we can check the vitamin D level. So when it has been checked that 24 hydroxy vitamin D3 level, when it has got checked, it came like 3 or 2.8 something. It was like that much low. So I told her this is a major symptom for your complaint. So most of the time she's not exposed to sunlight also, because she's like that only. And even if even if she's exposing to sunlight, there is very little only. And healthy diets and all she's having. But these things, mostly she'll be in room only with AC. That's what her lifestyle. So This has been diagnosed, and vitamin D supplement has been recommended because it was very low. So even only with the sunlight, we can't rise all on a sudden. Her symptom was that much worse. And I told her that like all the medications that you are taking for heart complaints, for neuro complaints, and she has also got migraine also, because due to this irregular sleep schedule, she got migraine also. So for migraine, she is taking another medicine. So I told like to stop all that and have this vitamin supplement. And if and all you are having any healthy diet to follow, I give the instructions for that also. So studies mainly telling like this vitamin D level, which has got high relation with the this panic attack. Most of the patients who are arising with these complaints of anxiety disorders or depression, almost 97%, and among those who are working in abroad also, this vitamin D level is very much reduced. And while giving the supplement, the symptoms are improving like anything. So this vitamin D, we all know that it helps mainly in the calcium absorption. So usually for bone complaints only, we'll tell the patients or to the other persons to check the vitamin D level, if and all any bone pain is there, if and all any pain associated with that. But this sleeplessness, I mean insomnia and panic attack and anxiety has got high relation with this vitamin D. And what this vitamin D mainly do, it absorbs the calcium. The calcium is very mandatory in sending the signals to our brain to nourish the brain. So for proper blood supply to the brain, this calcium is mandatory. So that is what the main, this vitamin D and panic attack has been linked. And importance of adopting a healthy lifestyle. It's already I have told, like, prioritize yourself first. Give yourself a me time daily, and eat a balanced diet. Eating a balanced diet in the sense, better to completely avoid the junk foods and have more green leafy vegetables, and which promotes the more which promotes the brain stimulation and all, like omega-3 fatty acid containing foods, nuts, walnuts. Walnuts has got high significance in improvising the brain power, and the patients or those people who were suffering with more depression and anxiety, these walnuts on a regular basis of 3 to 4, it's helping like anything. And coriander leaves and more green leafy vegetables also helping much for this vitamin, for this functioning of the brain. And stay active, that is what more important. Most of the time we live a sedentary life. It's not like our past 10 or 15 years back, like it is different from today. We are not at all active. So staying active will definitely improve your blood circulation to the body, to the brain, and it will make a happy feeling, and it will definitely reduce the depression state and anxiety state also. And alcohol and caffeine, I have already told that. Even smoking also have to avoid. And what are the ways we can overcome the panic attack? These are all things we can suggest for the people who are suffering with the panic attack. But literally what they feel as a person is that they are like completely lost. They were not able to do their day-to-day activities. These panic attack may lead them to a depression state. So I've gone through the patients, like more and more, they were in a high standard professionals, but still they were unable to do that day-to-day works itself. So we can give them a tip, like while coming this panic attack, while arising these symptoms, we can tell them to just count, do a breathing exercise that may help them to reduce their stress level. And just we want to teach them like it will pass or it will go away. Mostly for the persons, it will come for some persons, it will be like 30 seconds to 1 minute. But for some persons, it will be like, it lasts for half an hour. that literally their face and their energy, almost everything will be lost. And this is not happening, like they don't know when it happens, not like any particular time, like only it happening in the night or only it happening in the afternoon. So we would be aware about that. But these people, they don't have an idea when it comes. It comes all on a sudden. So at that time, we'll give some tips. So just have a face wash with the ice water, and to tackle the circles on the palm, to concentrate, to deviate them. That is what the main thing. If they are concentrating on their symptoms, like something is happening to me, it will worse, definitely worse. So for that only we are giving some tips to smell any calming scent. For some people, this scent even trigger or worsens the panic attack condition. So we have to deal with that. And imagining a peaceful scene, like a hypnotism and all, we can suggest them, like imagining a peaceful scene, like that we can tell them. And also like a smiley balls also we can give to them. And alternate tapping, that is a method mostly we will suggest for the patient and for the persons to overcome from this panic attack and anxiety. And majority of time, what happens is that these people even they won't, I told you, like they won't share with other people, that they'll think like it is a mental disorder, or they'll think like I'm mad because I'm only personally suffering. It is like a symptomatic one which I'm suffering, not like they have seen. So they are afraid to share with the peoples. But if and all needed, if it has been treated in the beginning, or with the counseling sessions, or the major causes that we have to trace out. And this scenario is mostly like if it is men is to women ratio, the women are more affected than the men. And for this, postpartum depression also has been associated with this. So the stress level and everything, we have to track it. What is the major cause? And we have to tell them to avoid the cause. If not due to any post-traumatic stress disorders or stress issues, we'll let them teach how to overcome from that. Like a professional, if a professional help is needed, definitely they have to approach. Otherwise, the condition become more and more worse, and this may not even affect they alone. The people surrounding them, like their children or their partners, or their mother or father, everybody will be affected due to their symptoms. Because it is literally like they are down and they can't do anything, they'll sit like anything. This may definitely affect the surrounding peoples. It's better to consult or to seek help, medical help, if needed, for cognitive therapy and personal development therapies and all. We can support with that. And if and all it is due to any deficiency, it's mostly what I will suggest that first go for the test. What are all the reasons? We have to first diagnose it. If there is no certain reasons, okay, that might be due to the mind stress level and all, we can treat accordingly. Mostly, if it is a cause due to vitamin D deficiency, or the nervousness or trembling is due to vitamin B12 deficiency, to overcome that by taking the supplements, or by taking the enough food which improvises the vitamin level. Hope I'm audible. Am I audible?
Yes, you are audible.
Okay. So this modern lifestyle factors is impacting, is giving a more and more impact for this mental health. That is very mandatory to keep our mental health in a very good way. Only if it is maintained, our physical fitness also will be maintained, and only then we can, like the medical professionals even can spread a goodness to others. So it is like the technology wise also we are improved like anything, but it is affecting negatively too. So the prevalence of this panic attack anxiety is more during these days. That's why I choose a topic today to share with you a few points of mine. Hope I have shared my views and all. And really thank you. Thank you for hearing my session.
Thank you, Dr. Jumana. It was excellent. And actually, this is needed for everything. It's a great awareness for everyone. As you told, it is a important subject nowadays. Everyone is saying, I'm depressed, I have anxiety. They don't even differentiate what is, I don't know whether they are saying, sometimes if they feel some difficulty also, they are telling it as depression. Even some people are in great depression, they are not realizing they have depression.
Most of the time, the people with severe depression, they won't might elicit the symptoms properly.
Yeah.
They're cool and calm. They're like cool and calm, and in the inner ways, they were dying like anything, but they'll be laughing and they'll simply laugh like anything.
Yeah.
That is what people with mild symptoms, and they'll only exacerbate these things.
Yeah. They say that I am suffering with some depression, I have anxiety. Likewise, they are exaggerating, and people will notice their symptoms and they will take care of those people those don't have any symptoms, but they don't care about others with more symptoms. And one more thing, you said about me time. That is very important. Everyone is even we are thinking to spend some time for myself, but
as a woman, what I have to tell you is that we won't give a me time to us. That is why, that we won't give a me time. We always feel like we live for we have to consider profession and we have to consider the family. That's all. That's how the circle it comes.
Yeah. And participants, you can ask questions now. Please raise your hand and ask question to Dr. Jumana. She'll answer your questions. I think many participants have many doubts about these subjects. She will clear your doubts. Please don't hesitate to ask anything. Please come forward. We have time. Now it is. We have. No one. So, Dr. Danesh?
Yes, Dr. Jumana, it's really a very good subject and you placed it in a beautiful way. And as we all know that the stress is one of the biggest problem nowadays people are facing. But unfortunately, whenever a disease happens to a person, they believe that it is something related to brain or some other disorder. But frankly, when you take the case in detail, you can find that there are something behind in it, and most probably some kind of stress. Even in the children, when they are studying in school, they are facing a lot of stresses from the parents as well as from the teachers and even from the students itself. And that is one of the reason why some brilliant students may struggle in the studies, and some of the people who are having no stress may become toppers in the last time. In the first part, I have seen a lot of children who are doing very good marks, scoring 100% in the first 10 up to 10 years. So and later when they are changed to some other school or some other reasons, when there may be some problem in the family, that these are the things that make them in trouble. And as a result, they may lose the first rank, and they may go to the second rank, or they may get to the third rank, like that. And that itself makes so lots of stress in them, thereby they may believe that, oh, I am not good for this kind of studies or like that. So they are losing the confidence, and once they lose the confidence, naturally their marks will also come down. And in those conditions, frankly, we as homeopaths can do a lot of things, but people have no belief. Usually what happens is that they believe that we can have some counseling. Of course, we can do counseling, and those when a person gives counseling, and the child is or the student is willing to take the counseling, then naturally that will be benefited. But in those cases where not only counseling, but also we have to give our homeopathic medicine the ailments from stress or ailments from um, some other problem. What we can, of course, the losing the we have a sort of lot of symptoms and a lot of rubrics like that, losing the sometimes it may be the insult, that may be the reason. Sometimes it may be losing the position. Sometimes it may not be. It may be some kind of hurt in the family or some other ways, other place. So all these cases need to be taken into details, and we can manage all this stress by homeopathic medication as well as our counseling. Anyway, what's your opinion on that? This kind of how will you manage this kind of children in your clinic? This is what I would like to ask to you.
Yeah, thank you for the question. Like children who are being stressed by their parents, right? It's what you're asking. Am I right, Doctor?
Yes.
For that, the counseling is needed for the parents, not for the students. That's what I am doing that, because the students, everybody IQ level is different, to be frank.
Exactly.
Everybody IQ level is different. Not everybody can score rank 1 and rank 2. And the rank 1 and rank 2 has got nothing in relation with life, to be frank. So that we should teach actually counseling the parents, like run, and so secure the first rank, study like anything. Even I've seen the like parents, they'll be like angry, and they'll be more irritated to their people, their daughters or son, their children, after seeing the progress card and all. Even if what I'll tell, like even if they have been failed in one subject, Lady P, you just tell them, like, all the 9 subjects you have passed, only one subject will improve. Like this, if you're telling to them, definitely they'll improvise themselves, the students. For the persons who are really needed medical support, like they are getting a memory loss, or they are getting an examination funk and all, we can definitely provide our medication supplement and all. But these like a 1 or 2 mark, or like a B plus, they are getting grade, or any, there's nothing got any relevancy in their future life. To be frank, that is what the reality. I think that all we all know. Because most of, even in our friend circle also, if we see that the person who were secured very low C plus or just pass, we were in a good life condition now, due to learning new things. That is the major thing we have to teach the parents, like daily they have to learn a new thing. Technology wise also, it will be helpful to lead their life. Just mugging up a few things from the textbook and vomiting in the examination paper, and securing a rank 1 and rank 2 without knowing anything. I mean, just mugging up without a precise knowledge, or without awareness about the society, or without awareness about how to live or how to overcome the failures. I think that is the main failure that students are facing. That time only the students are actually failing in their life. If the parents are not teaching how to overcome these failures, that most of the time what we will give, that we like spoon feed like anything. We want to teach our children how to overcome from the failures, how to overcome it, and how to solve that solution. Definitely that student itself know. We just have to ignite it. That is what we most of the time, what even if this counseling session and all, they itself know that They know the cause and they itself know the solution. For all the human being, it's like that. We know our problems and we know the solution itself. The only thing is we have to write it down, what it comes actually. So what the therapist or when we go for a counseling session, what they'll do, they'll hear everything. They'll hear whatever problems we are telling. What the today's problem is that there is no person to hear our trouble. That is the major problem we are suffering. So we are giving money to hear a person. That's what we are doing. And after hearing all these, answer it will come from ourselves itself. We know the solution. We themselves know the solution. Ourselves know the solution. The only thing is we are not eliciting it outside. You're not. If you sit calm, definitely you'll get a solution for your problem. Like each human being, even for the children also, they know how to resolve it. Don't give them a pressure. Don't give a person like pressure. You have to do. They know that. Okay, this is my fault in the last examination. I have to rectify these and these things. They know that. So mostly the counseling is needed for the parents. That's what I do usually. So I won't counsel for the students. If it is that much issue, like they are suffering with any like adolescent issues and all, definitely we'll elicit. For one person, one boy has studied, for one case, what I've gone through is, he was like very brilliant one. So this boy has got his studies done, and her mom is eliciting like anything about him. So just sit outside. I just asked him, what is something? He told like his dad is not with him, it seems, and mom is working in abroad. And what is the thing is grandma is telling telling him always like telling her mom to divorce his dad. So this is affecting him. So this is affecting him anything. He feels like in this age, his mom is like 44 or something. In this age, my papa is going to, my mama is going to divorce. So what will happen? This is the problem. This is what affecting, and he's like bunking the school and all. What I have done is, before that, I told just called her grandma is not to share a family issues or in front of the children. Mostly we'll do that mistakes. We forget that children are more brilliant than us.
Yes, excellent answer. Then how will you manage cases where vitamin D is deficient, and it may be the reason for the stress, and how what are the food you advise for that kind of patients, particularly those who are having loss of vitamin D and less vitamin D. But usually when we check most of the people now, what we find that most of the people are having vitamin D3 deficiency. It may be due to the technical problem with the lab, but or maybe the reason. Sometimes if they are, of course, we can say that since most of the children are students, our people are sitting in the home and not getting proper exposure to this sunlight, and so maybe the reason. But what are the food supplement you use to advise for this kind of patients?
Doctor Jumana?
Maybe.
She left, huh?
Maybe.
Yes. What happened?
No, some technical issues here.
Two more participants raised hand. Okay. Dr. Danesh, have you heard this question?
How will you, what are the kind of food supplements, or what are the food you used to advise to your patients, those who are having lack of vitamin and the stress is from vitamin D3 or vitamin D?
Vitamin D3 deficiency, usually we'll tell the patients to sun exposure and all, but after that, for anxiety and panic disorders, I will definitely recommend the omega-3 fatty acid rich foods and all, which is helping like anything like walnut, nuts, and like fishes and all. Also the green leafy vegetables, mostly like coriander leaves are helping like anything to improve the mental health and to improve the brain power.
Coriander leaves are to improve the mental health, or
to improve the brain power, even to improve the to reduce the depression, to reduce the anxiety. It's more helping. Actually, coriander leaf.
So, normally we put some coriander leaves in the curries.
Yeah. We
That
just use
won't
as a
help.
seasoning.
That won't help.
We can make a chutney and can have. So that will be a better option.
Oh, okay.
Full thing
Bulk.
will be going inside. Without that, we can't have. So it
Yeah.
won't taste good. It won't taste good.
Okay, thank you, doctor. And Dr. Hubert, before calling you, I am calling Dr. Mariamma. She was raising hand from the beginning itself. Dr. Mariamma John, doctor, are you there now? Dr. Mariamma, are
She
you
may
there?
be, she's showing that she's here. You can make her co-host. That's right.
Okay.
She's
Okay.
the next.
Yeah, I'll make her. Doctor, please ask your question and then we'll go to Dr. Hubert.
I want to know the homeopathic medicines used in panic attack.
Come again, doctor.
Homeopathic medicines used for panic attack.
Homeopathic medicines which has been used for panic attack. Mostly aconite, that we all know that, because this symptoms is very similar with the aconite thing. So aconite usually I use. And also I go for this batch flavor remedies are much more helpful, like rock rose and ornithogalum and all. That's also helping much to overcome the symptoms. Flavor remedies also
So
helping.
during the attack, if I mean, when they have the attack, that will help.
When they have the symptom, we'll tell the aconite only. Aconite to repeat. Aconite to repeat. That will subside. But mostly these flower remedies on a regular basis repetition, I'll provide for the patients. Like if it is in the early morning empty stomach, it is much better. Mainly this batch flower remedies are very much helping control the panic attack and anxiety. This what happened is that last time I think I have done a video regarding vitamin D and anxiety. So more and more patients are coming regarding this. So so I've tried with flower remedies. It is giving more relief to the patients rather than the other medicines also, like symptomatic medicines. Definitely it is gonna helpful. But apart from that, this main thing, their symptoms, it is correlation with aconite only, that sudden fear, anxiety, everything related with the, and to stimulate the brain power and all, crocus sativus also is helping. That's Kungumapu.
Okay.
Kungumapu is a brain empowering thing, right?
Okay. Dr. Hubert, now you can.
No, Dr. Jumana, very nice presentation. What I want to ask you, what to do for old age panic disorders? Old age panic disorders. In old age, they may feel that they will die or anything like that. There are counseling methods, and I want to really know the counseling methods. What is your approach?
Yeah. For the old age people also, definitely we'll check with the vitamin D levels and their supplements, everything, and what are the medications they are taking. That also have to be considered, because the medications which they were taking for long term, whatever it be, that might also have this side effects it may have. So we'll take into consideration, and we'll for their panic attack to come over that, we'll counsel accordingly to their surrounding peoples only. Because most of the time, it is not only their field. It is not only their field. During the old age times, it's not like they are feeling alone. Most of the time, they were like cornered. So we'll elicit the actual thing. We'll take the case accordingly, and I'll tell the bystanders also to consider these facts and all. And I think more and more panic attack cases, it's not coming in the late old ages. It's like what I have gone through the cases is mostly like 25 to 45 age people. This mid-age people are more suffering. I think those people in the old age, they are a little bit more stronger in their mental health.
Yeah, exactly. Exactly. In our
They might have taken coriander leaves, isn't it?
No, in our 20s, we are thinking, everyone is thinking about us. In our 40s, we came to know that, okay, not much people are not thinking about us. In our 60s, we will, no one is thought about me. So
They
you can understand.
only like mental illness we have to consider, like the bipolar disorder or anything else. Otherwise, this panic attack and all, it's not more affecting the 60 plus. They were more strong.
Yeah, more strong. That's true. That's true. And if they are getting a counseling, means that will help them more, because they have to tell something to others.
Yeah, the counseling in the sense, we also tell them to like to involve in physical activity. If like old age they are bedridden, we can't do that. Otherwise and all, physical activity is the very much mandatory thing, and to be involved in certain things, whether it is whatever in whatever way, like learning a new thing, even in the old age also it's might helpful, like technology wise also. If you are suggesting that, that might more helping them to overcome this panic attack symptoms and all, and even yoga and meditation also helping them a lot. Meditation is definitely helping. Counseling in the sense mainly just tell them like regarding their disorders, we have to tell. They are more concerned about their diseases and their symptoms. They have actually their problems, like BP will be there, cholesterol will be there, everything will be there, thyroid issues will be there, all lifestyle disorders they'll be going through. So we have to counsel them accordingly, according to their symptoms, what they are telling. If it is a real cause, definitely I'll call the family members and I'll tell them, everyone, to be getting in touch with them and or to spend time with them. That's what most of the old age people's need it. They are not actually what I told. They are not actually feeling it. They're not. It's not their feel. They are really cornered most of the time.
Thank you, Dr. Jumana.
Thank you, Doctor.
Now I'm calling Dr. Abida Salam for giving a lot of thanks to Dr. Jumana. Dr. Abida Salam. Please unmute and are you there, doctor?
Hello.
Ah.
Yeah, good evening all. Good evening. Thank you. First of all, let me thank my colleague, Dr. Jumana Doctor, who has been talking all this time. Wonderfully, she has carried out the duty of sharing the awareness, especially because which is required really in this era, like she also mentioned before. People really need to be aware about what's going on. So thank you, Jumana Doctor. Thanks a lot for the wonderful explanation, and clearing of the doubts also was very wonderfully done. Then thanks to all the participants who have been waiting till now and listening eagerly to her classes. So thanks a lot. And I think it's end of the session, and handing over back to Ajini.
Thank you, Dr. Abida Salam. Today I was hearing Dr. Abida Salam's class also. Really, really, this Abida Salam, Dr. Jumana, they are really concentrating on mental health. I really love you, the Basil group.
Thank you, because it's really need to be brought out. Yeah. People only can concentrate mostly about the physical issues, like so we need to give real awareness about this. So thank you. Thank you.
So, yeah, thank you, Dr. Ganesh, also for giving me such an opportunity. Thank you, Dr. Archini, and thank you all the participants to lending your ears.
We don't give you the chance. You are the part of IFPH, and you have to join with us. Okay. And thank you so much. Thank you so much. And Dr. Danesh, do you want to say something?
Yes, yes. We will upload the video of the same tomorrow itself, so that you can share it with your friends and colleagues, so that more people can watch it. And one request also, please ask everyone to subscribe the channel also, because IFPH is growing.
Yeah,
and tomorrow we will have a session from Dr. Prakash Rao sir.
Okay, thank you, Dr. Danish. Now it is the time for the Malayalam session. Every day I'm taking 2-3 minutes extra. So today I'm giving to Dr. Shaila. So thank you once again and love you all. Bye-bye. Good night.